Hello, friends. I'm Sarah Stryker. I am a nurse practitioner with Stryker Optimal Health and Wellness, and in this video, I'm going to talk about weight loss resistance. That's right. You have tried everything. You've tried ketogenic, paleo, plant-based, low-carb, sugar-free, dairy-free, and gluten-free diets. You've done it all. And you're stuck. You are stalled. You have plateaued. And there's food confusion. There's infobesity, meaning that there is so much information coming at you, like you're paralyzed. You don't know what to try next. Hang with me as I introduce the functional medicine approach that we have been using to get amazing clinical results with weight loss. Here's the thing. We need to understand it is next to impossible to lose weight when you are toxic, which is when you are inflamed and when you have cell damage. Toxic, in other words, is a state that promotes your body to hang on to fat as a buffer against toxins. It is a protective mechanism, so we must watch our toxins. Inflammation. Inflammation will hold you back, and there are a lot of drivers of inflammation. And that is why we tie in some objective testing. With food sensitivity and comprehensive blood testing, these objective results help address this inflammation component. But there are other things too, such as sugar, hidden sugars, hidden infections, and different things that drive inflammation. That is, again, going to hold you back, and it's going to hinder your weight loss goals and then lead to cell damage. However, before I get into that, our functional medicine protocol, we have the map, the framework, the blueprint, and it's an absolute game changer if you follow it right. There is a 90% success rate. It's not guesswork. It's not a one-size-fits-all or a cookie-cutter approach where everybody gets the same thing. It's objective, it's functional, it's customized, and it's tailored to you and how your body is reacting to food, where you are nutrient deficient and depleted, and helps identify toxins, bad fats, sugar, hidden sugars, inflammation, and your gut health. You must understand that fat melts off your body as a side effect of becoming healthy. Think about that. Write that one down. Fat melts off your body as a side effect of becoming healthy. My primary goal is to get you healthy, so it's going to come off as a side effect, right? People come through our clinic, through our functional medicine weight loss protocol. They want to lose weight. 20 pounds, 30 pounds, 50 pounds, or 100 pounds or more. That's fantastic, and it's achievable. However, they got other things bugging them as well. They are inflamed, they are achy, they have back pain, joint pain, neck pain, headaches. They have itises all over the place, right? They have brain fog, their gut is a mess. They have digestive dysfunction. They have skin problems, they have low energy, they have afternoon crashes, they feel miserable. So they have all these things. So let's clear that up, as well as melt fat off their body. We have successfully implemented this protocol into our clinic. We are talking about functional weight loss, right? Not guesswork, test work. So here's what I need to explain, and this is where I need to get into the weeds for just a second. I apologize, but this is why this protocol works so well. You must understand that your cells make up your tissues make up your organs. So if the cells are damaged, if they are broken, if they are inflamed, you'll never truly get well. In order to truly get well, you have to fix the cell, right? Here on the left is what a healthy cell looks like, okay? These little finger-like projections, they're called receptors. It's how your cells communicate. It's how your hormones communicate. It is how they get into the cells and do the work they need to do. But we also need the bad stuff, the waste, to get out of the cell, and the good stuff, the nutrients, hormones, oxygen, etc., to get into the cell. So there has to be this good flow. What do you notice here in the middle of the screen with dysfunction? There's red. Red is inflammation. But look at the receptors. They are blunted, they are broken, they are damaged. Look at disease on the right. More inflammation, more receptor damage, okay? Now, what causes this? Inflammation, right? And there's a lot of drivers of inflammation. Food sensitivities, nutrient deficiencies, toxins, sugar, hidden sugars, bad fats, right? I can go on and on. Heavy metals, stress, anxiety. So there's a lot of things that damage the cells. The good news is that we could push things into a more optimal direction because your body is always changing, healing, adapting, and regenerating. So it's not a permanent issue, but what you need to understand is that with inflammation leading to dysfunction and disease, for example, there's this thing called insulin resistance. There's also this thyroid issue. You may have a thyroid problem where we need to get T3 into the cell, but it can't because the receptors of the cell are broken. They are damaged, right? Inflammation basically jams up the cell. So we can't get the communication into the cell. So again, that is a classic definition of insulin resistance. Insulin cannot attach to the receptor to do its job in the cell. Now, you can take medication if you have prediabetes, which I would say the middle cell dysfunction would be prediabetes, and I would say the cell on the right, disease, would be full-blown type 2 diabetes. We have 88 million Americans with prediabetes. We have 35 million Americans with diabetes. So we have 1 in 3 and 1 in 10 to be in the dysfunction or disease category. You might already fit into one of these categories. Hopefully not. If you were insulin resistant, so that we could throw a bunch of medication at it, but it's like screaming at a cell that cannot hear. You are screaming louder, and they ratchet you up on all these medications. They scream louder and louder and louder at a cell that is broken, that is diseased, that is dysfunctional, right? So you must push things into a more optimal direction. We have to deflame and detoxify things at the cell level. We have to take a global look. We have to look at the big picture, okay? This is not just another calorie restrictive approach where you follow 800 calorie diet and the weight comes off. But then it's this crazy cycle of you losing 20 pounds, but you gain 25 pounds back. I'm not interested in this. I'm interested in a long-term sustainable solution, a long-term sustainable fat loss. Let's get this weight off, but let's keep it off long-term. But again, if you're stuck or stalled, you have plateaued, this is probably the reason why. There is underlying inflammation. There are toxicities involved, and we must detoxify and deflame. So here's what I want to do. If you're spinning your wheels, if you're sick of the medical runaround, maybe you're on some medication and you're feeling like trash, what I want to do is offer you a free consultation for functional weight loss. No cost, no obligation, 100% free. All I ask is that you show up and be motivated. Those are my 2 rules. Number 1, if you're going to carve out 30 to 60 minutes of my day, then carve it out of your day as well. We have a busy clinic here, so just show up. Number 2 is you have to be motivated to take action. You must be motivated to make change. This is what we do. We take functional approach, an objective analysis of you. We look at foods, we look at nutrients, we look at inflammation, we look at complete laboratory workup. We dig and find, and then work towards solving the underlying root cause. And that is why we get such great results. So again, we can't do your cooking for you. We can't do your shopping for you, but we are going to be the map, the framework, the objective blueprint for you to follow. And then miracles happen. And keep in mind that people that follow their customized protocol, weight is going to come off. And even more, They feel better, so much better. The brain fog clears. Their energy goes up. They sleep better. Remember, you heal when you sleep. They are less achy. They are less inflamed. Their skin clears up. There are so many other benefits. I hear all the time from our patients, oh my gosh, I feel so much better. Yes, I'm losing the weight. I'm looking better, but it's also they're functioning better. And they're going to live longer because they are going to get off this roller coaster of the standard American diet, which is spikes, dips, and crashes. Spikes, dips, and crashes. That's the standard American diet, you guys, which is insulin surge. Insulin is your fat storage hormone. So the insulin surge then crashes. Then that causes cortisol to surge. Cortisol is a stress hormone that causes stubborn belly fat. So if you're struggling with a muffin top or you got a spare tire, you can't get rid of it, it's likely too much cortisol. So we must get off this roller coaster that leads to disease and dysfunction, right? So 100% free consultation. Again, no cost, no obligation. Somewhere around this video, there should be a button or a link that is going to say book now or schedule now. Just click on it and it will take you into our patient portal where you can pick a free consultation, a date, pick a time that fits your schedule. And again, it's not high pressure, simply a chance for me to ask you questions and you can ask me questions. And then together, we'll see if what we have would make sense for you based on your goals. So click the button. We'll talk to you soon.